I have the pleasure of introducing and announcing the Jane Warren Award winners for this year. Just a little bit of background on this. The Jane Warren Award has been, we've been supporting this and graduate students and postdocs for this award to come and present to HEI's annual conference. The award is named after Dr. Jane Warren, who joined HEI in the 1980s and led HEI's scientific activities as Director of Science from 1999 until her retirement in 2008. For the first time, the Jane Warren Award winners will be presenting lightning talks, and as in the poster session that follows this session. We won't have time for questions, but we encourage everyone to go by and chat with our Jane Warren Award winners in the poster session. So our first presentation is going to be by Dr. Falco Stoffi. He is a postdoctoral student at Harvard University's Department of Biostatistics. So Falco, hopefully, oh, there we go. And the clicker, big green button.
Green. Okay. Thanks so much, everyone. I am really thrilled to be here today and to have the opportunity to present this work of mine, which is entitled Who is Most Vulnerable? It's a joint work with Francesca, Riccardo, and Kwansang. And in this paper, we developed a machine learning algorithm to understand who are the people that are most vulnerable when exposed to higher level of air pollution. This algorithm is completely data-driven, it has high accuracy, and it's highly interpretable. We started to develop this algorithm from a very policy relevant question. And the question is deeply rooted in environmental justice, which was recently defined from the Environmental Protection Agency as no group of people should bear disproportionate burden of environmental harms and risk. And we have seen in the panel before that we know a lot about the fact that minorities are structurally exposed to higher level of air pollution. However, there might be a little evidence on who are the people that are actually most vulnerable when exposed to this higher level of air pollution. And so our research question is, which are the characteristics of people that are the most vulnerable when exposed to levels of air pollution higher than the national ambient air quality standard? And to answer this question, we have to face a very important methodological challenge. Here you can see a number of potential algorithms and statistical methodology that have been employed or could be employed to tackle this issue. And we know that most of the literature has used regression models, which are highly interpretable. As you can see here, they range on high on interpretability, but little on accuracy. And these, while they are highly used to discover the vulnerability, they have three main drawbacks. So they require previous knowledge. So when you're running your regression, you have to interact your exposure with some variables that you have to know before. They are subject to cherry picking and they are not data driven. On the opposite spectrum, you have highly accurate methods like neural network and ensemble methods. We are deeply rooted in the AI literature, which however are not interpretable, are computationally burdensome. So to account for this shortcoming, we have developed this causal ensemble algorithm, which is a causal machine learning model, which is completely data-driven, interpretable, computationally efficient, doesn't need prior knowledge, and is not subject to cherry picking. And we have applied our algorithm to our extensive set of data, which Francesca has introduced previously, to understand who are the people that are most vulnerable in the Medicare population. We have data on more than 35 million Medicare enrollees when exposed in 2010-2011 to air pollution levels higher than national air quality standard. And what we found is that there is increased risk. We have stratified our analysis in the 4 census region for rural communities in the Northeast, Midwest, and South, Black communities in the South, low socioeconomic status communities in the West and South, and low income in the Northeast. And our algorithm has picked this without us producing any knowledge. So this is completely data-driven. We have also found some evidence on potential survival bias for some minority group. Since we try to do open science, all other resources that we use are available. We have a website for our method. We have a methodological paper, an open source R package that can be used, and reproducible code for this. and you can scan this code to find all the materials. Also, I'm happy to provide more information and answer any question later during the poster session. Thank you so much again for the opportunity.
Our next presenter is Sabrina Chow, who is receiving her master's from the Rollins School of Public Health at Emory University.
Great way to start that. Hi, everyone. Just want to say thank you for HEI for this wonderful opportunity, especially as a master's student to have this. So kind of building off the work that we've kind of heard previously about air pollution toxicity and carcinogenesis, and the work that the American Cancer Society is doing, we're kind of building on that next level of it and really looking at metabolic perturbations that are mediating the effects of ambient air pollution and lung cancer. So for my study specifically, we actually did a two-pronged approach. So really looking at the association between air pollution and lung cancer, we did two things. So the first thing is a meet in the middle analysis, which is kind of looking at metabolites specifically associated with air pollution and lung cancer individually, and then basically doing a Venn diagram to see what our overlapping metabolites were. And then for the second part of our analysis, doing that epicausal pathway to look at mediators and what metabolites really mediate that association between air pollution and lung cancer. So to kind of just highlight some basic results using a Benjamin Hochberg false discovery rate to correct for multiple comparisons, we were actually able to identify over 250 unique metabolites that were associated with at least one air pollutant, but there were multiples that were associated with most air pollutants. And then kind of adding in that lung cancer piece to it, we were able to identify 6 unique metabolites associated with both air pollution and lung cancer. To kind of visualize this a little more, for those who aren't as familiar with volcano plots, the x-axis shows the effect estimates after running our linear regression models, and the y-axis shows the p-values, the corrected p-values to show significance level, with the 2 lines representing 2 different levels of stringency. And I wanted to highlight 2 specific metabolites, including gamma-glutamyl glutamine and gamma-glutamyl methionine, which were significant in not only there you go. And not only multiple air pollutants, but also between both our meet in the middle and high dimensional mediation analyses, which showcase the potential that they have in mediating the effects between air pollution and lung cancer. So kind of knowing and based on all the information we have from our EPI studies and the effects that air pollution has on oxidative stress, inflammation, and DNA damage, we were actually able to hypothesize a mechanistic figure to showcase the associations that these metabolites may play in the association between air pollution and lung cancer. And kind of highlighting those 2 metabolites again, they play really important roles as mediators in glutathione metabolism, or GSH, which have been previously linked to differences in lung cancer stages, but ours is the first study that's able to kind of link that air pollution piece into as well. I have more volcano plots and more figures, and I'm happy to chat more during the poster session. Thank you.
Our next presenter is Libby Koolik. She is a PhD student in the Civil and Environmental Engineering Department at the University of California, Berkeley.
All right. Hi, everyone. My name is Libby Koolik. And with the team of collaborators from the California Office of Environmental Health Hazard Assessment, as well as the University of Washington, we set out to do an analysis to answer the following question. Have reductions in mobile source emissions in California contributed to a reduction in PM 2.5 exposure disparities for communities of color? So a bit of background and context. Systemic racism in both California and nationwide has resulted to disparate exposures to communities of color for fine particulate matter. California has been a nationwide leader of emissions controls, especially in the mobile source sector. And so we thought to do an analysis here and see if those reductions in emissions have corresponded to reductions in environmental justice disparities. So we took a state regulatory model of on-road mobile source emissions, ran it through a custom tool that uses a reduced complexity model framework, and evaluated population-weighted mean exposures. And ultimately, our main finding is this. While exposure concentrations have gone down across all groups in California, the relative disparities in exposure have not gone down. So if we look at this figure here on the left, we see that for every single racial ethnic group in the state of California from 2000 to 2019, their population-weighted mean exposure has gone down. And for an environmental policy, that's great news, right? We've made everybody's air quality better. But if we look at this figure in the right, which shows the relative disparity in exposure for each racial ethnic group as compared to the state average, we see that these lines are really flat when, for context, a really good environmentally just policy would see them converging around the zero line. And for Hispanic, Black, and Asian Californians, those lines are actually increasing slightly, which means that their relative disparity in exposure has actually increased. So once we had this finding, we decided to do a number of sensitivity analyses and follow-up studies to figure out why have these disparities persisted. So I'm going to show you one right now, and then please come by my poster to see a couple others. And so when we looked at the absolute disparity in exposure broken down by individual vehicle groups, one of our top findings here is that the light-duty vehicle sector is actually contributing between 60 to 70% of the maximally exposed groups disparity. And while I think it's easy to say, oh, great, so let's just mitigate light-duty vehicle emissions, in reality, this pattern of exposure is repeated for every racial ethnic group. So it's not as straightforward to just target a single source, and instead we need to target where those sources are occurring and where those disparities are occurring. And so our ultimate finding here is that reducing emissions is will not necessarily reduce the exposure disparities that are faced by our communities of color in California, without specifically looking at the factors that are leading to those disparities. So I look forward to your questions and comments at my poster this afternoon. Thank you so much, and thank you, HEI.
Our next presenter is Alina McIntyre, who is receiving her PhD from the Environmental Health Department at Boston University.
Thanks so much. So I'd like to first start by saying thanks to HEI and thanking my co-authors as well, many of whom are here at the conference for these few days. And I'd also like to acknowledge our academic and community partnership between BU School of Public Health and Green Roots in Chelsea. So to begin, Chelsea ranks third in Massachusetts for asthma-related hospitalizations. Chelsea's just across the water from us right now. And Nerys, who actually lives in Chelsea, reflects on this, saying, all of my children have asthma. We have lived with prescriptions for pumps and machines, and because of this, it's really important to have air, clean air. And Chelsea is really far too contaminated. It's really bad. We need more air filters, including in our neighborhood. And so, motivated by many additional resident voices and already occurring environmental justice efforts in Chelsea, we sought out to implement a PAC, or personal air cleaner efficacy pilot, in partnership with Green Roots. So we did a lot of recruitment and education to ultimately recruit 8 households in Chelsea. And we used a lot of different technology to measure exposures, namely hobo data loggers that measured our HEPA air filters, or the PACs in this study, their use. And we had QuantAQ particulate matter filters, which measured PM1, 2.5, and 10. And then ultimately we had baseline demographic and health surveys throughout. And all of this data was used to answer the question in some regression models: how do the PAC usage patterns impact particulate matter concentrations during the study period? And so the headline of the study, the headline of our results here, is that PACs did significantly decrease particulate matter when filters were turned on, so when they were in use. But we observed a lot of variability in both PM concentrations and the PAC usage themselves. And so let's zoom on this a little bit. So on the y-axis is hourly mean PM 2.5, and on the x-axis are 4 time periods: night, morning, day, and evening. And we see the distribution of PM 2.5 in 3 different filter settings. So in the dark color, no filter present. In the blue, the filter is present, but it's not being used. And then in the pink, the filter is turned on, so actively being used. And we see that there is a decrease going from not using the filter to actually using the filter. But speaking to the variability here, the PAC usage does vary between those same time periods. So the percent is actually turned on, and by participant. So there's a lot going on here. And ultimately, the factors that we were unable to measure will be really interesting to look towards in our future work. And it was very interesting to understand feasibility and challenges that go into a pilot study like this, and ultimately how this data can or cannot be used in future air quality intervention efforts in Chelsea. And thank you all. I look forward to discussing this during the poster session.
Our next presenter is Jenni Shearston, who is in the process of getting her PhD in environmental health sciences from Columbia University.
Thank you. And I just want to say that I'm really excited to be here. So thanks so much for this opportunity. And I'd like to start off first by acknowledging my co-authors who are all listed here on this slide, as well as our funding source, which is the National Institute of Environmental Health Sciences. And so I wanted to talk with you today about our study titled, Can Traffic-Related Air Pollution Trigger Myocardial Infarction or Heart Attacks Within a Few Hours of Exposure? So as we've heard a lot already today, air pollution from traffic can certainly impact our health and can trigger heart attacks, but it is not clear how soon after being exposed to traffic that a heart attack might occur. And it's also not clear if exposure to even 1 or 2 hours of traffic pollution at lower concentrations especially can trigger a heart attack. And this information is really critical to ensuring that current hourly air quality standards, the NAAQSs, adequately protect our health, which led to the objective of the current study. To characterize the hourly hazard period for heart attacks after short-term NO2 exposure in a US state with NO2 levels below the air quality standard. So this will be New York State from 2000 to 2016. And we're using NO2 as a marker for traffic-related air pollution. So at the top of this slide in blue is really the headline of our results. So we found that traffic pollution can trigger a heart attack within 6 hours of exposure, even at concentrations below the current air quality standard. And so to walk you through this plot in a little bit more detail, on the x-axis, if we imagine that unfortunately I have had a heart attack, I would have that heart attack at hourly lag 0. And that means that hourly lag 5, that would be my exposure 5 hours before I had the heart attack, and at 10 hours before I had the heart attack. So on the y-axis here, we have MI rate ratio, the risk for having a heart attack. Anytime this brown line and gray shading is fully above that horizontal line at 1, I'm at increased risk for exposure for a heart attack. And you can see that from lag hours 0 to 6, there's increased risk for having a heart attack. So what does this mean? Our findings suggest that current hourly air quality standards may be insufficient to protect cardiovascular health. The mean NO2 concentration in our study period during this time was 23.2 parts per billion. The current NAAQS for NO2 at the hourly level is 100 parts per billion. And while that is measured with a 98th percentile for 1 hour daily max concentrations, I also calculated that those are also substantially below 100 parts per billion for this time period. So we're hoping that this information, the study, might be useful when the EPA next reassesses NO2 NAAQS values. Thanks very much.
Our final presenter for the 2023 Jane Warren Awards is Dr. Matt Shupler. He's a postdoctoral student in public health policy and systems at Harvard University. He was previously at the University of Liverpool.
Hi, everyone. Thank you to HEI for this opportunity. The title of my talk is Put Your Money Where the Stove Fits, using household air pollution measurements to prioritize locations for clean cooking intervention in sub-Saharan Africa. This study involved 24-hour household air pollution monitoring of PM 2.5. It was done in 3 rapidly urbanizing communities in Obuasi, Ghana, Balmayo, Cameroon, and Eldoret, Kenya. This was done among 40 households cooking with LPG, which is liquefied petroleum gas, which is considered a clean cooking fuel, and 40 using biomass, which is mainly wood or charcoal. Going right to the results, the graph at the top is showing average 24-hour PM2.5 kitchen concentrations. I have a dashed line there showing the WHO interim target, which is 35 micrograms per cubic meter. The graphs are showing the breakdown by community and primary fuel type. And you can notice that all of the bar graphs there, or box plots, are above this interim line, showing that exposures denied or concentrations were above that level. In the green boxes is LPG, and those concentrations from LPG were the lowest compared to wood and charcoal in the red and blue boxes. However, I've highlighted in the middle community in Ghana that there was no difference between LPG and charcoal. And this relationship actually held at the graph at the bottom, which is showing 24-hour cook exposures. So then digging further, we also had data on when participants were cooking and when they were not cooking. So I have the graphs here showing in red the average concentrations when they were cooking, and in blue is when they were not cooking. So at the top, among households cooking with LPG, we actually see in 2 of the 3 communities that kitchen concentrations were actually higher during non-cooking periods than when cooking, suggesting that there may be other sources of exposure. In the middle graph, this also held in one community, again in Obuasi, among households cooking with charcoal, that exposures were actually slightly higher during non-cooking than cooking periods. And finally, looking again at one community in Obuasi, we had data on proxies of ambient exposure, specifically the distance they had to the closest road. So the graph here is showing a stratified analysis by travel time to the nearest road, and then whether or not the participant who was the main cook left their household during the monitoring. And you could see going from shortest travel time to longest travel time that the actual cook exposures decreased pretty substantially between those less than 5 minutes and greater than 10 minutes. Additionally, cooks that reported leaving their home consistently had higher exposure than those that did not. And so again, this is highlighting that there are likely other sources of exposure. And as Robert O'Keefe mentioned in his talk, that there's rapid motorization and rapid urbanization. And so in these communities, in some cases, just providing only access to clean cooking may not be enough, that there needs to be targets to address outdoor air pollution, namely from traffic, trash burning, and other emissions. And because of this, when we're thinking about providing access to clean cooking, approach where you're targeting areas where HAP is the greatest contributor to exposure may help have the greatest health impact. Because we can see from this work that the 3 communities, the difference between LPG and biomass fuels was very different in terms of PM2.5. Thanks, everyone. I'm happy to talk more at my poster.
So once again, I'd like to congratulate our Jane Warren Award winners, and please do stop by and talk with them at the poster session. And now, Dan, you're going to give us instructions for the evening.